Once they stop one substance, they try to shift to another substance. That is common because they need the dopamine deficit to be occupied with something. So one thing in addiction treatment, definitely medication is helpful. Second thing is counseling definitely helps. Third thing, giving them support and breaking the stigma, not labeling them as addict, treating them as people with normal disease, so people will come forward for the treatment, giving them proper support, and family counseling, family support is very important, as you said.
Good morning, ma'am.
Yeah.
I am a practitioner, de-addiction counselor since last 25 years. Actually, I am developing myself for more age-related issues also, working for adolescent and young ones for de-addiction management, as well as doing family therapy and sobriety management through holistic platform. I wanted to ask you one question from Dr. Sandeep Kondepi. Many a time I have gone through so many persons. So once they are in chronic state or totally dependent on some sort of addiction, most of the time they prefer cocktail addiction. So what is the etiology in our brain? So one thing is not able to satisfy ourselves. So people are switching over other. Many a times when after this de-addiction therapy, we go for follow-up. So people are taking the medicine as well as they are trying on other substances. For example, he has given up alcohol, so he will be trying tobacco, or he will be trying some sort of pan or gutka or khani. So some supplement, the brain needs some supplement. What is the etiology of our brain functioning under this switching over different addictions?
So it's exactly what, thank you ma'am, exactly what you have said is correct. Once they stop one substance, they try to shift to another substance. That is common because they need the dopamine deficit to be occupied with something. So one thing in addiction treatment, definitely medication is helpful. Second thing is counseling definitely helps. Third thing, giving them support and breaking the stigma, not labeling them as addict, treating them as people with normal disease, so people will come forward for the treatment, giving them proper support, and family counseling, family support is very important, as you said, because it plays a core part in the treatment. So the family support is very important. And as you said, once they're across, they're shifting from one substance to substance. That's what I'm telling. The reward is hijacked by the substance. So again, you need to get addicted with some healthy behavior to hijack it back. So you need, so for example, I saw many patients, my patient, he got addicted to preparing pizzas. He got addicted to swimming. He got addicted to gym. One of my patients got addicted to dancing. So now they say that once I dance, I'm getting more dopamine than what that I was getting from the drug. So you need to make your dopamine deficit normal by doing things which increases dopamine, and these things should be in a natural and healthy way.
One thing more, you might be laughing at me, particularly in spouse therapy. Many a times this spouse and particular family awareness, it is to be dealt very from the grassroots, because family, they lost their confidence in the patient. So it's a very big issue. And secondly, there is one thing, as you told about that people start from a little bit expensive or Johnny Walker or for some teachers and some, but many a times they are acclimatized to this country liquor also.
Yes.
So is there any difference in the metabolic or symptomatic response to the taking this? Because it is not safe, but people prefer it in long term.
Yeah, because the country liquor and the man-made liquor has no regulations. There are a lot of impurities in it. For example, if you see the natural toddy is safer, but the man-made toddy which you get in the toddy shop is mixed with benzodiazepines, sleeping pills. They mix sleeping pills in the toddy to get the similar kick. So it is very risky. there is a high chance of withdrawal symptoms and even life-threatening withdrawal symptoms like seizures, and also they go into delirium. It is very hard to treat. The first part, the difference is mainly the treatment part. The withdrawal symptoms are very severe, and we need to react promptly and aptly for the man-made liquor or the local toddy.
And that is very fatal many a times. We have gone through some
yes, ma'am.
deaths also in such cases. Thank you, sir. It was very nice. Thank you, sir. Thank you. So kind of.
Sir, I'm asking you a very a question which may not be appreciated by some. Why are our governments depending on selling alcohol, especially if you have said that this alcohol being sold today is not toddy and it is added with sleeping pills? Why is an entire generation, because today at least 70% of the men in the villages are addicted to alcoholism. How is it that such well-educated, upcoming states which have been role models for the entire country today, like Telangana and Andhra, why are the governments depending on alcohol, allowing 70% of the men in the villages become dependent on alcohol, ensuring an entire generation and their families are devastated?
When it comes to crime and politics, ma'am, this man invented everything. Man experienced everything. Now we say this is not good. This is, for example, if you take cannabis is there approximately from 10,000 years in Vedas. But now we say it is harmful, it is not harmful. So people are getting confused. One thing is that it is definitely alcohol, tobacco is the highest revenue for the entire country. So, but as you said, non-regulated alcohol should be stopped immediately. And we can't change the law, or we can't change the things, how people react and how people accept substance use, but we need to create awareness, and we need the treatment approach, the access to treatment. If we do, at least we can do the harm reduction. So the already harm has happened. So if we create awareness now, at least we can start doing the harm reduction.
So one, you're advising there should be regulated alcohol. In fact, I've been hearing there should be regulated drugs also, because there are different kinds of drugs. Some are very addictive and some are normal. And there are parts of the world where certain kinds of drugs are...
Yes, ma'am. Yes, ma'am. Yes, to continue that, see how much government do, how much we try to prevent, how much we do. Man is the most intelligent mammal on this earth. If you stop one thing, I will invent another thing. If you stop cannabis, I will do synthetic cannabis. You stop synthetic cannabis, I will do laboratory cannabis. So this is not going to stop, ma'am. In my perspective, we can't stop this, but definitely we all should try to stop this. Telangana government, as I'm part of the Narcotic Drugs Psychotropic Act, along with the Telangana government, I'm working, ma'am. They're doing vigorous work to stop cannabis in Telangana. They're doing a very good job. But see, like now the synthetic cannabis is into the market. You can prepare cannabis in your balcony, in your lab. You can grow cannabis. No, it comes in an oil. Nobody can find out. Now they caught the oil. Now it is coming in a capsule, like a medical crocin tablet. So it's very hard even for the government to take regulations and stop all these things. But definitely, as you said, we have to do some strict guidelines to stop the illegal market or the black market.
There is a specific question I'm asking. The question is, I understand there are various different kinds of drugs. So I want you to help me understand what are the various different drugs in the market, point one. Point two, which of them can be legalized, which of them cannot be legalized, and why?
In India, the legalization is the alcohol, smoking, which comes under legal drugs. Smoking, tobacco chewing or smoking, and alcohol are the legal drugs. And in few states, bhang, which is made from cannabis leaves, is legal. As we take it on Holi, on the occasion of Holi, they take the bhang, meeta or the bhang liquor. These things are legal. And the things which are made illegal are cocaine, heroin, meth, crystal, opioids.
You're going too fast. Can you go a little slow?
Sorry.
Cocaine, heroin,
So, cocaine, heroin, crystal meth, that is MDMA, ecstasy, and now newer psychotropic drugs, newer psychotropic substances. It comes under NPS. You don't have a name. I can prepare 100 drugs in my lab and I'll release it today. So you take cocaine, I'll change the molecule, ma'am. I'll change the molecule. I'll make it cocaine. Yes. It is called coke. Yes. I invented it today. So this is coming into market. Now synthetic drugs. You can see cannabis in a spray. They spray on the cigarette and they smoke it. How? So the trend has changed. The people now come with laboratory drugs and also prescription drugs. Prescription drugs includes the painkillers, anesthetics, and sleeping pills. So prescription drugs, hard drugs, legal drugs. Legal drugs in India are alcohol, bhang in some states, and chewing tobacco is legal. These are not made legal by the government, man. This is legal since many years. It is from our culture. We invented that. So the tobacco is in culture.
You said alcohol and cigarettes and toddy are legal. However, cocaine, heroin, crystal meth, and new psychotic drugs, these are illegal. Is there anything in these items which are illegal? What is it? Marijuana? I mean, I seriously don't understand drugs, so you need to. What is marijuana?
Marijuana, weed, ganja, grass, cannabis, everything is the same, ma'am. These are the street.
Weed, ganja.
Marijuana, weed, cannabis, ganja, grass, green. There are different words. Pot. These are the street names, but cannabis, marijuana are the legal terms. It is illegal in India completely now.
Do you think it should be made legal?
Definitely, it will be made legal in the coming future.
Because
it's not about smoking cannabis. I'm not telling. See, ma'am, one thing we have to understand: everything has its advantages and disadvantages.
I'm with you totally.
I'm just explaining. Even if you take cocaine, it has its advantages and disadvantages. It is we who should decide whether we have to go to it or we should not go it, whether it is legal or illegal. When it takes cannabis, there are many medical benefits from cannabis, but not from smoking cannabis. Smoking cannabis will increase a chemical called THC in the brain, which gives the high. That's why we smoke. But the medical properties of the cannabis, definitely there are benefits. For example, now chronic seizures, chronic pain, HIV weight loss, and cancers in carcinomas, not to treat the carcinomas, but to treat the pain. Medical cannabis is being legalized in many countries. So now India, also in Asia, also many countries are in debate to legalize cannabis, but the medical cannabis, the regulated cannabis, the beneficial cannabis. So beneficial cannabis, you can't become an addict because it will not give you the high. But the cannabis which currently we are taking throughout the world is synthetic, adulterated, and with more THC. If you take THC 20 years, 15 years back, THC is a chemical which decides your dopamine. THC is a chemical with which you get addicted in cannabis. THC percentage was around 0.5 to 1% 15 years back. 20 years back, the Rushi, jo Himalayas mein they take cannabis, ganja, it was 0.5 to 1. Now the cannabis which you are getting in market is 25 times potent than the older THC. So we made it more potent to drag more people, to make it more addicted, to make it more high.
In the 1970s, the US forced the UN to ban cannabis in several countries, including India. And 30 years later, US has actually capitalized on it. They have legalized it for recreational purposes. They have also created hybrids that create a lot of dependency chemically. And now we are basically we burnt most of our natural resources, and now even hybrids are being produced in India. There are people selling adulterated things everywhere in the country. So definitely certain form of regularization or regulations would be required to counter cannabis. I mean, US is already promoting it in various different forms. We are still stuck up with the notion that, okay, it's bad because it was banned. The people who banned it have legalized it already.
And why have they legalized it?
For medical research and for medical purposes. I mean,
everything drug has been studied by FDA and CE, Europe, Canadian government, everybody. They are researching on cannabis and they're definitely finding some good properties with cannabis. It's not only with cannabis, ma'am. As I said, with every drug, there is a minimal advantage. But what is that advantage? How we can regularize it, how we can make it non-addictive is more important. So, as I said, if now even FDA is trying to do research on crystal meth, the methamphetamine, which is a stimulant. So they're trying this stimulant in people who are depressed. But it not comes as powder, which you inject as a drug addict, but it comes as a capsule, which you take.
Okay, Mr. Shmuel, you need to unmute yourself to ask your question.
Yeah, thank you. Okay, I want to ask you about social aspects of addictions. I want to ask you if we need to see direct connection between addiction and phenomena of poverty, social inequality, social problems, and very maybe addiction this more social problem and less medical.
Yeah. So to give a gist, definitely social problems, the social environment, the childhood history, the culture, the stress during the childhood, the access to the substance, all these things are social factors. Even the most important factor, a risk factor, is discrimination. So usually once the community is discriminated or one group of people are discriminated, for example, a gay culture, lesbian culture, or transgender culture, or they are more prone into addictions and more prone for suicides. So all the social factors plays a role. The social factors, the psychological factors plays a role till you try it. Once you try it and get attached to it, then the changes in the brain takes place. So it is equally important, the social factors. That's why addiction is called biopsychosocial model. The social factors, psychological factors, biological factors all together play a role.
Is your question answered, Mr. Shmuel?
Yeah, of course. Thank you very much.
Mr. Tokala Satish, will you please unmute yourself? Yes, we can hear you.
Yes,
Hello,
sir,
sir.
I can hear you. Please.
Yeah. I am attender of your patient, Mr. Toka Rajesham. You might recognize me. He was there in a rehab for 2 months actually.
చెప్పండి.
సార్ అతను ఇప్పుడు రిలాప్స్ అయ్యాడు సార్. రిలాప్స్ అయ్యి మళ్ళీ ఆల్కహాల్ తీసుకుంటున్నాడు. మళ్ళీ ఒక రీహాబ్ లో పెట్టాను. మరి ఏంటి ఎట్లా చేద్దాం ఫర్దర్ గా?
That's what I'm saying కదా. See, addiction లో relapse is very common. When relapse is common in me, నేను ఎంత డైట్ చేద్దాం అనుకున్నా నేను బింజ్ ఈటింగ్ సడన్ గా చేస్తాను. సో దట్ ఈస్ ద రిలాప్స్ టు మై డైట్. నేను ఎక్సర్సైజ్ ఎంత టఫ్ గా చేద్దాం అనుకున్నా కొన్ని రోజులు నేను స్కిప్ చేస్తాను, మళ్ళీ ఐ గెట్ రిలాప్స్. హ్యూమన్ బీయింగ్ హ్యావ్ ఎ టెండెన్సీ టు రిలాప్స్. డయాబెటీస్, హైపర్ టెన్షన్ మనం ఎలా ట్రీట్ చేస్తున్నామో లైఫ్ లాంగ్, ఈ రిలాప్స్ అనేది అడిక్షన్ లో చాలా కామన్. సో రిలాప్స్ వచ్చింది అని మనం వదిలేస్తే he'll become more addicted and he will harm his health. So addiction lo the first law is at least harm reduction. Manam relapse ayindani odilekunda we need to catch him. See, I definitely as family you'll be stressed out, financial burden అవుతుంటుంది, ఎన్నిసార్లు పెట్టినా మళ్ళీ డ్రింక్ చేస్తున్నాడు అనే థింక్ కి వస్తారు. I understand all those concerns, but definitely finally we have to help him to come out of it.
ఓకే సార్, అతను మళ్ళీ రిహాబ్ లో ఉన్నాడు సార్. యాక్చువల్లీ వేరే రిహాబ్ లో పెట్టాము. ఇంకొక 6 months వరకు అట్లనే ఉంచుదాం అనుకుంటున్నాను సార్. కొంచెం అది ఫైనాన్షియల్ గా మాకు అఫోర్డబుల్ ఉంది. 6 months వరకు ఉంచుదాం అనుకుంటున్నాం. వాట్ డు యు సజెస్ట్? లైక్
see, it's not about the time అండి. It is just leaving him in rehab is not a point. మళ్ళీ తను బయటకు వెళ్ళిన తర్వాత ఏ సొసైటీలో ఉంటాడు, ఆయన వర్క్ ఏంటి, ఆయన ఆక్యుపేషన్ ఏంటి, ఆయన ఫ్యామిలీ సపోర్ట్ ఎంత ఉంది, అలోన్ గా ఉంటాడా లేదా, ఆయన జాబ్ ఏంటి, అవన్నీ కూడా మనం తీసుకోవాలి. పుట్టింగ్ ఇన్ ఎ రీహాబ్, abstinence వస్తుంది, ట్రీట్మెంట్ వస్తుంది, వెరీ గుడ్. బట్ గోయింగ్ అవుట్ there should be external community support kuda. Malli బయటకు వచ్చిన తర్వాత again if he's lazy, not doing work, no family support, wife తనకి ప్రాబ్లమ్స్ ఉన్నాయి, ఏదో ఒక డిస్టర్బెన్సెస్ వస్తుంది, మళ్ళీ there is a high chance of getting relapse. Definitely medication will help, but the society and the community kuda change cheyali.
Okay, thank you sir.
Thank you.
Question is from Mr. Vamsi Krishna. There will be very thin line between addictive and non-addictive, often difficult to assess. So are there any red flags that it is swinging towards addiction?
So as I said, the criteria for addiction is, see, everyone has some habits, we do it routinely. All the habits kuda manaki dopamine pathway paina act avutayi and increases dopamine. In addiction em avutundi ante there are changes in the brain, like for example tolerance, which increases the receptors and you drink more. Once you drink more, you can't stop it. Once you try to stop, you'll have withdrawal symptoms. Once you have withdrawal symptoms, you drink to reduce the withdrawal symptoms. After that, you'll have a severe urge. And irrespective of your social, family, occupational, society problems, you will drink. You lose control how much you drink and what you are drinking. And there is a lot of salience to provided, and a survival low, you replace the natural rewards with addiction. So addiction becomes your survival. So that is how a habit and addiction you can differentiate. See, once you are doing a habit, if it is doing good to you in and around A to Z, anni manche chestundi ante, then it is okay. Few people are addicted to gym and they'll bear that pain, they'll bear that stress, and they go to gym daily. So they're addicted to gym. That definitely is good. But in chemicals, it is different. So you usually, the red flags నేను చెప్పాను కదా, the tolerance, withdrawal, salience, irrespective of harm, ఇవన్నీ వస్తాయి. If you generally see in children who are getting addicted, decrease in academic performance, drop out from school, irregular to school, late night spending, more time with friends, alone in the room, hiding something, abnormal behavior, sudden increase in anger, irritability, all these things you can take it as red flags for a child to you being using some drug or something.